When we hear the word radiation, it's tempting to picture huge explosions and frightening mutations. But that's not the full story. Radiation also applies to rainbows and a doctor examining an X-ray. Even bananas contain trace amounts of a radioactive potassium isotope. So if we live in a world of radiation, how can we escape its dangerous effects? Doctors shield body parts they don't need to examine. And why beachgoers use sunscreen. In comparison, cell phones and microwaves operate at the lower end of the spectrum, so there is no risk of ionizing radiation from their use. Fortunately, acute exposures are rare, but we are exposed daily to lower levels of ionizing radiation from both natural and man-made sources. One way scientists compare ionizing radiation exposure is a unit called the sievert. An acute exposure to 1 sievert will probably cause nausea within hours, and 4 sieverts could be fatal. However, our normal daily exposures are far lower. The average person receives 6.2 millisieverts of radiation from all sources annually, around a third due to radon. At only 5 microsieverts each, you'd need to get more than 1,200 dental x-rays to rack up your annual dosage. And remember that banana? If you could absorb all the banana's radiation, you'd need around 170 a day to hit your annual dosage. We live in a world of radiation. However, much of that radiation is non-ionizing. For the remainder that is ionizing, our exposures are usually low, and choices like getting your home tested for radon and wearing sunscreen can help reduce the associated health risks. Marie Curie, one of the early radiation pioneers, summed up the challenge as follows: "Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less."